The innovation team at RP is physician-led. What's unique about our process is it helps us to evaluate the impact of AI tools through the lens of the physician end user, because that reflects how AI is used in the real world. And as we started to use and evaluate AI tools, we noticed that some AI was well received and immediately helped our patients. But other AI tools, they just didn't pass muster in the real world because either the accuracy suffered or the upside just wasn't there for us as physicians, or it impaired our ability to practice effectively and efficiently. And so we developed this 5-step process that helped us work through the factors that determine whether an AI tool is likely to be successful when we deploy it to our radiologists on the front lines. The first step is we measure AI performance just like everyone else, but crucially, we do it on our patients in our local practice settings, right? And that's important because we know that the AI accuracy can vary a lot depending on where you practice and how you acquire your images and what machines you're using to do so. And as radiologists, we need the AI tool to be correct more often than not when it's grabbing our attention and disrupting our workflow, because the AI thinks there's an abnormality, right? And so this is reflected in a metric that we call the positive predictive value. And we like to see that the AI tool is more accurate than a coin flip, right? That predicts to us whether a radiologist will trust the tool and actually engage with it to deliver better care. The second thing that we look at is the enhanced detection rate. What we like to see is, does the AI help us with our blind spots as humans? Does it help us overcome our natural human biases? In particular, can it help us avoid misses if we're fatigued at the end of a shift or if it's the overnight hours? And this is where we can measure this enhanced detection rate to predict, how much we can boost our performance. Step 3 are the wow cases. We focus on those because that tells us where the AI is likely to make a difference for the radiologist. And so they're primed with that knowledge and can take best advantage of the tool, right? Like if they know that it's going to help them on complex cases where there's many diagnoses, and it can help them to make that 5th diagnosis that they might not have seen otherwise, because it's normal to fall victim to what's called the satisfaction of search bias. The AI can help you overcome that natural human bias. And that's where you really gain from these tools. Is we all have limitations as human physicians, right? But the AI can help. It's not subject to the same biases, and so it can help you to overcome them. And so we look at, these wow cases are essentially the cases where our human limitations are overcome by the AI. That's what we mean by a wow case. Step 4 are AI pitfalls. As the human user of these tools, you have to be intimately familiar with the downsides, with the limitations, with the pitfalls, with the mistakes and the patterns of mistakes that the AI tends to make. Armed with that knowledge is how you are successful with these tools. I like this last step. It's where we bring all of the upsides and the downsides together, and we capture it in a simple metric we call the gain to pain ratio. And basically what it's trying to capture is, how effective is this AI tool at improving our diagnostic performance without bogging us down by, false alarms that, interrupt us and make us less effective as physicians? If you take the time, make the effort to go through this process locally, in your practice, you're going to learn so much about your own practice of radiology. Honestly, it has benefits in every aspect of what I do as a practicing physician, right? You learn about your own blind spots, your own weaknesses as a physician. You learn about opportunities to deliver better care in your practices, and you have the best chance of success with AI, right? I think that's really where this 5-step process comes in. If you go through this, yes, it's reality is it's work, it's effort, right? It takes time to go through this, but there's a big payoff.